It's the end of day 2 at TCT here in Washington, D.C. With me, Deepak Bhatt, once again, my co-worker in crime. Deepak, it is day 2, and probably the most important and certainly high-profile trial to come out of here is Greg Stone's trial on left main stenting versus coronary bypass surgery. So I'll give it to you to summarize, and then we can chat about this a bit.
Yeah, sure, and I agree with you. Probably what people will view as the biggest trial coming out of here is this trial, Excel, which is, I think, definitively addressed the question of which is better, bypass surgery or PCI for left main disease. And overall, both strategies performed very well. So I guess from an interventional perspective, I'd say it was a win, and PCI looked very good. Signals were consistent with prior studies in terms of things like stroke and TVR, but overall at a top line level, both strategies looked pretty good.
Yeah, I'm going to say, well, maybe, okay, because we've done this before. Lots of other trials have looked at this, and it's always been sort of the same record. Yes, they seem to be about the same. And then when you look at target vessel revascularization, the stent guys just don't do as well because bypass grafts, particularly limas, will last forever. You know, I always tell fellows, if you get a lima lad, you live forever. And there's a certain truth to that.
Yeah.
And so you have to ask yourself the question, as you look at these data once again, and again, target vessel revascularization was greater in the stented group. If you had a left main stenosis, would you want to have surgery or a stent? So I'm going to ask you. You're on the table here.
All right, so if I'm actually on the table, symptomatic left main disease, I think it depends on the anatomy.
There you go.
If it were an isolated osteal lesion, I would definitely say throw a drug-eluting stent in there. I'd go to an experienced operator like you and said, hook me up. If I had really complex bifurcation disease, you know, a CTO of the distal right, a tight bifurcation circ lesion as well, at that point I'd say, look, just assuming I'm a good surgical candidate at low stroke risk, I'd say, look, just open me up and do bypass.
You know, when you look at this trial, which I think is an important trial, you can turn it around the other way and say, you know, coronary bypass surgeons do a pretty good job. They do a very good job.
Yeah.
And there are still going to be a lot of people who ultimately will probably need surgery, particularly as everybody gets older in the world.
You know, I agree with you, and I think and it brings in the heart team and how important a concept that is, and you helped popularize that concept in the TAVR world. I think it applies to coronary revasc. The other part of this trial that's important, though, is, you know, at 30 days, PCI really did look better. Yeah. With longer follow-up, you know, CABG catches up and then maybe starts to look even better with longer-term follow-up. So I think the patient's opinion matters, because for some people, they're going to say, look, I'm not worried about 3 years or 5 years from now. I just want to make it through the next few months, you know.
Well, in that case, get a stent and run.
That's right.
But the fact of the matter is, it's a fascinating trial. It's an important trial.
Very important.
Gives some important information. And like everything else in medicine, it still depends on the individual patient.
That's right. Depends on the patient, depends on the doctor, the hospital, the team, all of the above.
Thanks, Deepak.
Thank you.